The psychological impact of eating disorders on mental health. Eating disorders are often associated with severe psychological distress and can lead to long-term mental health consequences. While these conditions primarily involve unhealthy eating habits and distorted body image, they are deeply rooted in emotional and psychological struggles. In this article, we will explore the psychological impact of eating disorders and how they affect mental health. 1. Low self-esteem and body image issues. One of the most significant psychological effects of eating disorders is the impact on body image and self-esteem. Individuals with eating disorders often have a distorted perception of their body size and shape, which leads to negative self-image and low self-worth. Body dissatisfaction. Many individuals with eating disorders believe they are overweight or unattractive, even if they are underweight or have a healthy weight. This distorted view of themselves can drive them to engage in extreme dieting, purging, or other disordered eating behaviors. Negative self-worth. A poor body image often leads to low self-esteem. People with eating disorders may feel unworthy or inadequate, and their self-worth may be entirely tied to their appearance or weight. 2. Anxiety and depression. Eating disorders are often co-occurring with anxiety and depression, as the individual may struggle with overwhelming feelings of guilt, shame, or fear related to food and body image. The constant preoccupation with food can exacerbate feelings of sadness, hopelessness, and distress. Chronic anxiety. People with eating disorders often experience chronic anxiety about food, weight, and appearance. This anxiety can become all-consuming, making it difficult to focus on other aspects of life. Depressive episodes. The constant emotional and physical strain caused by an eating disorder can lead to depression. Feelings of hopelessness or emptiness may accompany the disorder, leading to a decrease in motivation and engagement in daily activities. 3. Obsessive thinking and compulsive behavior. Individuals with eating disorders often experience obsessive thoughts about food, weight, and appearance. These thoughts can lead to compulsive behaviors, such as restrictive eating, purging, or excessive exercise, to relieve the anxiety or guilt associated with their thoughts. Preoccupation with food. People with eating disorders are often consumed by thoughts of food and weight. This preoccupation can lead to ritualistic behaviors, such as counting calories, weighing themselves frequently, or avoiding social situations where food is present. Ritualistic behaviors. These compulsions are often a way for individuals to exert control over their environment and body, but they can also further reinforce the unhealthy relationship with food. 4. Social isolation and relationship strain. The psychological toll of eating disorders can lead to social isolation and strain on relationships with family, friends, and romantic partners. Shame and guilt often prevent individuals from opening up about their struggles, and they may withdraw from social situations to avoid judgment or negative feelings. Avoidance of social situations. People with eating disorders may avoid parties, family gatherings, or other social settings where food is involved. This avoidance can create significant emotional distance between the individual and their loved ones. Relationship difficulties. Eating disorders often cause tension and misunderstandings in relationships. Family members and friends may feel frustrated, helpless, or confused, and the person with the eating disorder may feel misunderstood or judged. 5. Long-term psychological effects. If left untreated, eating disorders can have long-term psychological effects, including chronic anxiety, depression, and body dysmorphia. These issues can persist even after the eating disorder itself has been addressed, requiring continued mental health support and therapy. Ongoing therapy, cognitive behavioral therapy, CBT, and other therapeutic approaches can help individuals rebuild their sense of self-worth, address anxiety and depression, and develop a healthier relationship with food. Key insight: the psychological impact of eating disorders is far-reaching, affecting body image, self-esteem, and emotional well-being. Addressing these psychological factors through therapy is essential for recovery and building a healthy relationship with food.